Hey, how are you today?
I'm good. How are you?
I'm good. I'm Brittany. I'm going to be your nurse today. Um, the doctor has several orders today that we're going to go over. We're going to do your lung sounds. We're going to do heart sounds. We're going to do fall assessment, safety assessment, your HEENT assessment, and then your range of motion today. I'm going to provide some privacy for us, which I just shut the door. And I'm going to perform hand hygiene. And can I get your name and your date of birth?
Yes, ma'am. My name is Samantha Green, and my date of birth is August 27th, 2005.
Okay. And can I check your wristband? All right. Thank you so much. Let's see. Are you having any sort of pain today?
No, ma'am.
Okay. Let's see. Apparently I've lost my pen. Okay, let's see. Okay, so first we're going to start out with a neurological assessment. So I'm going to ask you a couple questions, and this is just going to let me know that you're conscious and oriented. Do you know who the current president is?
Yes.
Who's that?
Biden.
Okay. Do you know where you are?
Yes.
Okay, where are you at?
The doctors.
Okay. Do you know what time of day it is?
It's afternoon.
Okay. And what's the reason? Do you know what the reason is for your visit today?
Just physical.
Just a physical? Okay. All right, so patient is conscious and oriented. She answered all my questions, so there is obvious no brain damage from just a neurological assessment. Next, I'm going to palpate your head just to check for any sort of abnormal protrusions or anything that I need to be aware of. So I'm just going to feel her head behind the ears. And everything feels pretty normal to me. So the scalp and her face, they're normal coloration, so that is good. Do you have any history of headaches?
No, ma'am.
No? Okay. Let's see. Next, we're going to do her ear assessment. And what we're going to do is we're just going to look at your ears. Just make sure everything is properly located where it needs to be. Let's see. So, okay, looks like the auricles are symmetric in size and in placement. And it looks like the helix, which is the outer rim of the ear, the tragus, which is this piece, the smaller piece on the inside, the lobule, and the auditory canal, they all look pretty normal to me. Next, we're going to do a hearing acuity whisper test. So I'm going to whisper something into your ear, and then you just repeat it back to me. And by doing that, that allows us to know if she's having any hearing loss or any abnormal hearing.
EQ2.
Okay. So the patient read that or said that back to me successfully, so we know she's not having any hearing trouble. Are you having any difficulty difficulty hearing any low or high pitched sounds?
No, ma'am.
Okay. Let's see. So next we're going to do your nose assessment. We're just going to look at the external to make sure everything is where it needs to be, and then we're going to look inside the nares. Okay. So patient's nose is symmetrical and midline on the face, and patient nose internally is smooth and moist, and there is no signs of swelling or drainage. Have you had any recent nosebleeds?
No.
Okay. Any trauma to the nose?
No, ma'am.
Okay. Next, we're going to do the mouth assessment. So we're just going to take a look in your mouth and check that out to make sure everything is, make sure there's no abnormalities there. All right, can you look up for me? Okay. Smile. All right. All right, patient's gums are pink. They tightly fit around her teeth. Teeth appear smooth, shiny, and they're varying degrees of whiteness. Her buccal mucosa is pink, glistening, smooth and moist, no abnormalities there. And then her lips are symmetrical, smooth, moist, and pink in color. Have you had any recent gum bleeding?
No, ma'am.
Okay. Next, we're going to do the neck, throat, and jaw assessment. We're just going to make sure all that is normally positioned. So patient's neck is normal positioned, midline and above the suprasternal notch. There is no lumps or swelling that I can see. Can you swallow for me? Okay. All right, so patient has no sign difficulty swallowing. Are you having any sort of pain in your throat, sore throat?
No, ma'am.
Okay. Let's see. Next, we're going to do your eye assessment. We're just going to take a look at them first. I want to just see what size your pupils are right now, and then we'll do a light assessment. Okay. Let's see. All right. So she's about a 5 right now. Her pupil, that is dilated. So we're going to do the eye test, where I'm going to put the light in her eye, and her eye should constrict. So what you do is you just bring it to the side and just have the patient look at you, or look at an object that's, stationary. And you don't keep it in there long. You come back around. All right. And both of her eyes constricted normally, like they show with the eye. So it is, let's see. So they do respond to light. So that is normal. So right now, patient eyes are parallel. They're aligned in the socket, no protrusion or sunkenness. Pupils are of equal size, round with a normal border. And then patient has a normal response to light. Both eyes did constrict. So typically we would do a vision Snellen test when you do a physical. And that's where your patient would read off a standardized chart. Or a card with letters on it, and then they would stand at 20 feet away and read those to check for vision as well. Are you having any excessive watering or discharge from your eyes today?
No, ma'am.
Okay. All right, so we're going to do some range of motion. Are you having any pain in your joints or muscles today?
No.
Okay. So we're going to do the range of motion on your elbow. So what I want you to do is place your arm like this, okay? And then just turn it over. All right, and then I want you to pull your arm up like you're flexing it. All right, let's see. So let's do that again. So lay it back down. All right, and pull it back up. Okay. And let's see. And then we're going to lay it back down. And then what I want you to do is try to hyperextend it, so like where it's pointing downwards a little bit. All right, those feel good. muscles there. Next, we're going to do the forearm. So it's going to be this. So basically, you're just going to have, you're going to do supination. So what is that? Let's see. So that's going to be having your arm facing upwards like it is. And then we're going to flip it. And that is your pronation. So that's your hand facing downwards. And everything feels normal like that. Do it one more time for me. Okay. All right, next we're going to do the knee. So you're going to bend your knee, which is already it's already in flexion. So you're good there. So what I need you to do now is extend both knees out like you were just extending your leg. So
at
that's
the same time?
no, just one at a time. Okay. So let me come back over here and feel behind the knee. Let me do that. There we go. Okay. All right, and those feel good. And then we are going to check your ankle. So you are going to, I got your ankle. So you're going to point your toes upward and keeping your heel on the wood here. And then you're going to do the same thing, but downwards. Okay. I'm going to do it on the other one. Okay. All right. So that range of motion looks good. Next, we're going to check your lung sounds. When the diaphragm touches your skin, she would, in a normal setting, she would have her shirt or draped down. So when it touches your skin, I just need you to take a deep breath for me, okay? All right, let's see. All right, and that's your right upper lobe. Your left upper lobe. Sorry. All right. That is your right lower lobe. Oops, sorry. We need to come down here. Okay. And this is your left lower lobe. If you could, take this arm and bring it up like this. And I'm going to get your lateral sounds. Okay. And those sound good. Are you having any trouble breathing today?
No.
Okay. So your physician has documented that he would like us to educate you on the turn, cough, and deep breathe technique. So basically what it'll do is it'll break up the mucus in your lungs if you have any, and it'll prevent you from being admitted into the hospital for pneumonia. Mm-hmm. So what you're going to do is you're going to turn, cough, and then take a deep breath. Okay. So that will help. Also, that we do have incentive spirometers if that technique doesn't work. And it basically, you breathe into it, like you inhale, and you'll see the ball rise and then release. And that's also going to break up mucus as well. All right. We're going to inspect your jugular vein. And that's going to be in your neck here. If you turn a little bit to the side. All right, I'm going to check this side as well. All right, everything looks good. All right, then we're going to assess your capillary refills. So hold your hands out. All right, color comes back less than 2 seconds, so you're good. And then we're going to check your upper and your lower extremities for any edema. So, right, no edema. And then next we're going to listen to your heart sounds. And then as I'm over the areas, I'm just going to call them out to you. So this is the aortic area. This is the right of the sternum in the second intercostal space. Just to the left there is the pulmonic area, left of the sternum, second intercostal space. Down just a little is the Erb's point, left of the sternum, third intercostal space. Come down a little bit more. That's your tricuspid area, lower left of the sternum, fourth intercostal space. And if you could lift your breast for me, we're going to listen to your mitral area. All right, and this is left of the sternum, fifth intercostal space on the mid-clavicular line. And this is also the apex, so you'll hear your heartbeat the most here. And everything sounds good there. So we're going to flip the diaphragm over to the bell, and then we're going to go in the same order and listen for any sort of heart murmurs. Lift that breast again for me. All right, everything sounds good there. Have you had any recent falls?
No, ma'am.
Okay. So no falls. And then in a safety assessment, we would just declutter patient care area. Make sure that the patient's personal belongings are all with them. That way they won't have to get up and try to get it themselves and they could possibly fall. Check the environment for safety. Make sure the patient's comfortable. Do you need any water? Any pain medication? Are you in any kind of pain?
No, ma'am.
Okay. Let's see. And are there any other reasons for the visit today other than a physical?
No, ma'am.
Okay. That'll be the, let's see. And do you use any sort of ambulatory aid to move around? Like, okay. So she walks on her own, doesn't require any ambulatory aid. So that is the end of our assessment, and I will let the physician know of my findings. All right, you have a good day.
You too.